Hi, I'm Dr. Maxwell Jen, a physician of anti-aging and regenerative medicine, and today we're going to be talking about SCULPTRA. So when I recommend SCULPTRA, I find that a lot of patients are still getting confused, getting mixed up between products like SCULPTRA, the hyaluronic acid fillers, and even the botulinum toxins like Botox, even though these products have been around for 20 years. So we're very simply put, Botox and the botulinum toxins like Dysport, Xeomin, and Jeuveau, they're just there to help relax the muscles. If you have very deep wrinkles you want to fill in, or if you're losing volume and you're getting that caved in look, Botox is not going to save you. If you are having those really deep wrinkles, or you're losing volume from aging, like for instance in the temples or even in like the lower cheek area, you want that filled in, then you're gonna have to be looking at the volumizers like hyaluronic acid, like SCULPTRA, and in some cases other alternative volumizers like fat transfers or even silicone. Fat transfers are a little bit involved because it does involve fat harvesting, and silicone is not approved in the US, so let's just talk about hyaluronic acid and SCULPTRA. Hyaluronic acid is just a molecule that's really good at grabbing onto water molecules and holding onto it. And so when you're injecting hyaluronic acid into the face or anywhere on the body, the way that you're getting that volumized effect is simply put just getting a little bit swollen. So once you put that hyaluronic acid in, the hyaluronic acid will grab onto water molecules, hold onto it, and you will be volumized with water. SCULPTRA is very different. SCULPTRA doesn't rely on water to achieve its volumizing effect. When you inject SCULPTRA in, the SCULPTRA actually stimulates the cells in your body to start laying down sheets of new collagen. And so over time, as you grow more collagen in, that volumized effect will actually be volumized with new collagen as opposed to hyaluronic acid and water. So the big difference there, as you can probably guess, is that collagen will last a lot longer than hyaluronic acid and water. And so while even some of the more robust hyaluronic acid fillers can last for maybe a year or two, in many cases even shorter than that, even a couple of months, SCULPTRA, according to the FDA, can last for up to 2 years, and anecdotally even for up to 10 years. So there are varying advantages and disadvantages when you're talking about volumizers like hyaluronic acid versus SCULPTRA. Me personally, I don't use any hyaluronic acid in my practice. If I do need a volumizer, I find that I'm always going for SCULPTRA because there are a lot of advantages and safety profile risks that I enjoy far more with SCULPTRA. So while there's lots of different advantages to SCULPTRA, my favorite ones that I'd like to highlight is that it's a very forgiving product. So whereas you might see a lot of migration when it comes to hyaluronic acid fillers, migration just means you inject it and it moves away. With SCULPTRA, you actually want it to move a little bit because you get a far more natural appearance. Also with SCULPTRA, the way that you use it, when you inject it, it's much easier to be safe about it, to reduce your complication rate with SCULPTRA relative to hyaluronic acid filler. So me personally, I like to use SCULPTRA. So if you have more questions about hyaluronic acid versus SCULPTRA, or you're trying to figure out what might be best for you, by all means, please seek out your local provider, your local trusted provider, and ask far more questions. There's never any rush to doing these volumizers, so you really want to make sure you choose the product and the provider that's going to be best for you. If you have any more general questions, you can leave a comment down below and I'd be happy to answer them. And again, my name is Dr. Maxwell Jen, and I'll see you in the next video.